Hey everyone, this is Scott, and today I'm going to be going over the anatomical structures of the upper and lower limb. This will be relatively exhaustive to the items on your list. It won't include the things that were on your last practical exam, the pelvis and the abdomen bony structures. Those structures usually do not appear on this exam, and so I won't be going over them today. So we're going to start proximal and move distal, and we'll start with the upper limb. So let's start with the scapula. So the thing about the scapula, like pretty much any other bone, is the first thing you have to do is sort of orient yourself. So the way we're going to do that is by looking at the structures that kind of pop out at us when we're looking at the bone. So if we're looking at this surface, we notice the spine of the scapula, this structure right here, sort of pops right out. This is the posterior surface of the scapula when you see the spine of the scapula coming out at you. As opposed to the anterior surface, you'll notice that it's smooth, there is no spine of the scapula. So this is the anterior surface, and this is the posterior surface. Okay, so the next thing you have to do is orient yourself medial to lateral, right? So the way we do that is by looking for the glenoid, right? So the head of the scapula is our glenoid right here. That's always on the lateral surface, right? That's where the humerus attaches. So that's going to be our lateral surface. So once we know posterior, anterior, lateral, medial, now we can start naming some of the large structures and areas on the scapula. So to start out, so we're looking at the posterior surface, okay? So basically, like I said, this right here, this is the head, right? Right here, let me get my pen here. This right here, let's see if I can zoom in here for you. So this right here is the neck, kind of goes around like that right here. That's the neck of the scapula, and everything else pretty much like this part right here, that's the body. These are structures that are kind of hard for to be tagged on your exam, but just to kind of get an overview. Next, we have the borders. So this is the vertebral, aka the medial border of the scapula, right? And this is the axillary or lateral border of the scapula, which they're all good terms to use. This is the superior angle of the scapula, and this is the inferior angle of the scapula. Once again, we have the spine of the scapula here. We all know these landmarks well, the inferior angle and the spine of the scapula from our vertebral landmarks. And then we wanted to go over surfaces, okay? So, as we're looking at the posterior surface, the surface that is above the spine of the scapula, that is the supraspinous fossa. And the area that is underneath this surface right here, underneath the spine of the scapula, is the infraspinous fossa. In the glenoid, right, this surface right here, that is the glenoid fossa. And then when we look on the anterior surface, this is the subscapular fossa. Okay, so anterior surface is the subscapular fossa. Other big structures that you obviously need to be aware of is this at the end, right? This right here, that is the acromion, right? This is, again, posterior surface is the continuation of the spine of the scapula laterally. That is the acromion, right? And then on the opposite side, on the anterior surface, this little guy spinning out towards the front, that is the coracoid process. Okay, not coronoid, coracoid process. All right? Some other structures to be aware of. At the very top surface of our glenoid, this little bump, let me get my pen here, this little bump right here, basically the very top part of our glenoid, that is the, well, we call it the supraglenoid tubercle, okay? And at the bottom is the infraglenoid tubercle, okay? So supraglenoid tubercle, that's where the long head of the biceps attach, and the infraglenoid, that's where the long head of the triceps attach. Okay, so more things right here. You can see this notch, right? This little space above the spine of the scapula on the superior surface of the scapula. That is the, you can call it the scapular notch or the suprascapular notch. Either term is fine. They say suprascapular on your structures list, so that's what I would use. Now then, if I turn the scapula, so you're looking at the superior view, this little curve right here, this space, that is referred to as the spinoglenoid notch. Spinoglenoid notch. This area right here. Okay? So with that, those are all the structures you need to be aware of for the scapula. Okay, next we have the humerus. Okay, so once again, let's orient ourselves. So it's not important to differentiate left from right per se, but you have to definitely know on the humerus whether you're looking at the anterior or posterior surface, and whether you're looking at which side is lateral and which side is medial. So if we look at the proximal end of the humerus, we can see the head, right? So the head obviously points to the medial side. The question is this the medial side of a left humerus, or is this the medial side of a right humerus? And the answer will come when you look at the distal end of the humerus. So if we look at this end, we have a bunch of things kind of, again, jutting out at us, towards us, right? As opposed to if we look at this surface, we have this big gash, this big hole, right? So the big gash, the hole, that is the posterior surface, which means this is the anterior surface. So if this is the anterior surface, and we know that the head of the humerus points towards the medial side, then we know that we're looking at a left humerus, which means this is lateral and this is medial. Okay, that is what we first need to do when we look at the humerus. Okay, so get those landmarks down. All right, so let's now name some of these things. So like we said, we have the head of the humerus, that's the ball into the socket, right? And then we have the neck. Now, we have to be very careful here. We have two necks, if you will, quote unquote, of the humerus. We have the anatomical neck, which connects the head to the shaft, right? And that's this right here. It kind of circles around this side, right? So it's just distal to the head, as opposed to the surgical neck, which is a frequent site of fractures. So this area right here, roundabouts, that's the surgical neck. Right, so if you had a surgical neck fracture, that's when it's going to put you at risk of having axillary nerve injury. Okay, next we have our tubercles. So the most lateral. Okay, I don't want to say it's the larger one. It's called the greater tubercle, but sometimes, as you can see even here, the lesser one, which is this one, looks a little more prominent. But the most lateral, this big bump right here in the lateral surface, that is the greater tubercle, which makes the one that's kind of staring you in the face the lesser tubercle. And again, we're looking at the anterior surface right now of the humerus. So lesser tubercle and greater tubercle of the humerus. Between them, right here, this space, right, that is the intertubercular groove. Okay? Now, kind of following down the humerus with, after our intertubercular groove here, we see this bump, right? You can kind of appreciate this ridge right here. That is the deltoid tuberosity, obviously an attachment site for our deltoids. Now don't get that confused with this, which is more on the lateral surface. Someone highlighted it because it's very, very hard to see on this bone. But there's sort of like a groove right here that's kind of curvy, and it's kind of coming along the lateral side of the humerus, right? We're looking at the lateral side. That is the spiral groove, sometimes called the radial groove, right? On your common structures list, it's spiral groove. And that's where our radial vasculature, so we have the radial nerve and the profunda brachii that kind of spiral around the side of the humerus. That's where they are, right? So a midshaft radius fracture or a spiral fracture, a humerus fracture can cause injury to those structures. Okay, looking at our distal surface, a lot of things going on here. So again, this is the anterior surface. We said this is the lateral surface. So this bump right here, that is the lateral epicondyle. And this bump right here, that is the medial epicondyle. Okay, looking at these surfaces, right here, this surface is sort of roundish. I don't know if you can appreciate it, but this kind of has a round appearance. That's called the capitellum, right? And that's where the head of our radius is actually going to fit right in. So that's the capitellum. And this space that has some little writing in there, that is the radial fossa, right? So where the radius kind of bends up and down onto the humerus, as opposed to this side. So this right here, this surface, kind of spindly in shape, that is the trochlea. Okay, that is the trochlea. All right, and then right here, that is the coronoid fossa. Coronoid with an N in there, right? That's where the coronoid process of the ulna is going to fit in, okay? So, once again, capitellum, trochlea, radial fossa, coronoid fossa. And then finally, on the opposite side, we have this big gaping hole, right? That's the olecranon fossa. That's the olecranon of our ulna is going to fit in. So the big guy back here, that's the olecranon fossa. And that, folks, is the humerus. All right, so let's move on to the radius. So the radius is one of those bones that kind of just looks like a stick, and you have to really be able to differentiate it from the other stick-like bones. So it's not a very hard bone in terms of the structures once you figure out that it is in fact the radius, but you have to identify it. So the way you identify the radius is using this kind of mushroom-shaped top. No other bone has this mushroom-shaped top with the flat top on the, at the fossa at the top. So that's very characteristic of the radius. In terms of the structures, very simply, so we have the head, right, which is the mushroom top. We have the neck, right, which is kind of like the stalk that's holding onto the head, right? And then this bump right here, that is the radial tuberosity, okay, radial tuberosity. Moving on to the distal edge, the very, very most distal point that kind of dips down like this, that is the radial styloid. And if we look at this surface, right, not this, the surface is kind of flat, you can see that, but this surface right here, this little bump right here, that is Lister's tubercle, or the dorsal tubercle, right, Lister's tubercle. And that's really it for the radius. All right, next we have the ulna. So now the ulna is not one of those bones that just looks like a stick. It has a very characteristic shape to it. Kind of looks like a movie wizard staff or something. Like it has this kind of C-shaped thing going on up here. It looks kind of like a monster. So that's the ulna. It looks very interesting compared to the rest of the bones. So in terms of the structure, it's pretty simple. So up here we have the trochlear notch, this surface right here. Right, that fits right onto the trochlea on the humerus up there. And by the way, this people are going to yell at me because they're like, "This is not a left ulna." This is not. This is actually a right ulna, but that's what came in my box, so I put it here as if it was a left ulna. It is not. It's a right ulna, but it really doesn't matter. So again, trochlear notch. This guy right here, that is the coronoid process. It's going to fit right into that coronoid notch on our humerus. If I go a little more distal underneath all this business, I kind of shaded it in here. That is the ulnar tuberosity. It's really not much to speak of. It doesn't look like much, but it's the only thing that could be here if he tags it on the exam. So that's the ulnar tuberosity. And then the only thing on the distal end is this guy right here. So this guy, that is the styloid process of the ulna. Okay, styloid process of the ulna, or the ulnar styloid. And then the only other thing, very obvious on the posterior surface, right? That's our olecranon process, right? It's our elbow right there. Okay, and that's the ulna. All right, let's move on to the last set of bones you have to know for the upper extremity, and those are the bones of the hand. So right here, this is a left hand. I kind of just place it how it would normally sit. And I can tell it's a left hand using two things. Not that you really have to know it's a left or a right, but it kind of can help you orient yourself when you're trying to figure out the carpal bones. So first of all, kind of a dead giveaway is the thumb, right? The thumb has one metacarpal and only two phalanges, as opposed to the rest of the fingers, which have metacarpal and three phalanges. So you can, if you identify the thumb, at least you know that you're looking at, the lateral side of the hand versus the medial side. In terms of palmar surface versus dorsal surface, so the palmar surface, the carpal bones in the palmar surface kind of all have, not all of them, but a lot of them have these parts that stick up and kind of protrude towards the palmar surface. So the palmar surface has these bones sticking out, as opposed to the dorsal surface, which is much more flat, right? There's no bones kind of sticking out. So palmar surface, lots of bones sticking out compared to the dorsal surface. So in terms of figuring out the carpal bones, so I'll kind of show you from the palmar surface and the dorsal surface so you can see and appreciate it. But if you can orient yourself with the thumb and whatnot, then you can get started. So let's start with this big bone, which is the most proximal. This guy, that's the scaphoid with its tubercle. Okay, so the scaphoid bone is the most commonly fractured bone amongst the carpal bones, and is at risk for avascular necrosis. Kind of clinical pearl there, in case you didn't know. Next door to the scaphoid is the lunate. So this is the lunate, and the lunate is the most commonly dislocated bone in the hand, the carpal bones. All right, and then next to, a little more distal, but next to the lunate is this bone right here, and this bone which is on top of it. So this is just kind of a dead giveaway when you see this little bone on top of this bone, but this is the triquetrum, on top of which is the pisiform, this little sesamoid bone that sits on top. So pisiform on top of the triquetrum. Next to them, moving laterally, we have this bone right here. That is the hamate. I mean, it's kind of a dead giveaway as well because it has this bone that's kind of sticking up. That's part of the hamate. That's the hook of the hamate. So the hamate with its hook. Moving more laterally, this bone is the capitate. Okay, don't get the capitate confused with the bone that's in the foot, known as the cuboid. Right, they're both kind of these random bones in the middle of the hand or the foot. The capitate, think capit, meaning head. The capitate is closer to the head, it's on the hand, versus the cuboid, which is on the foot. All right, and next to the capitate, we have this bone. That is the trapezoid. So the trapezoid is next to the capitate. And then finally, this bone that's connecting to our thumb, that is the trapezium. Okay, trapezium. So to get these, the trapezoid, trapezium, triquetrum, to get these not screwed up, first of all, the traps stay together. Trapezoid, trapezium, they are next to each other as opposed to the triquetrum, which is far away. All right, so the traps stay together. And then to remember this one that's associated with the thumb, think trapezium, thumb. Thumb. So you don't get the trapezoid and the trapezium screwed up. Okay? Little memory trick for you. You may have heard this before, but just in case you haven't, to remember the order of the bones. So starting with the scaphoid, moving towards the pinky, we have so long to pinky. So long to pinky. Scaphoid, lunate, triquetrum, pisiform. And then continuing, moving from the pinky towards the thumb, we have here comes the thumb. Here comes the thumb. Hamate, capitate, trapezoid, trapezium. Okay? Looking at the dorsal side, it's again it's still very straightforward, but just going in the opposite direction. Right? Scaphoid, lunate, triquetrum, pisiform underneath. That right there is the capitate. Then we have the trapezoid and the trapezium. Okay? By the way, the trapezium supposedly has a little tubercle. It's kind of not seen here. It might be this, but it's not easily seen. And then, of course, you have your metacarpals, right? Your proximal phalanges, your middle phalanges. My pinky is a little, there we go. Middle phalanges and distal phalanges. Okay? And those are the bones of the hand. All right, now let's move on to the lower limb. So we'll start with the biggest bone in the body, the femur. Okay, so femur, very characteristic, right? It has this kind of flamingo head thing going on there. And if you've never noticed, it looks like the head of a flamingo. Now you know. So how to identify the anterior surface and the posterior surface of the femur. So you can do it two ways. If you look at the proximal surface, you'll notice when you look at the proximal surface, this area is very smooth. While if I flip this over, bam, right? The lesser trochanter kind of insults you as you're looking at it, right? So if it's sitting on the table, the lesser trochanter is kind of sitting there insulting you, while if I flip it over, it's kind of hidden, pressed up against the table. So when the lesser trochanter is sticking out there insulting you, that is the posterior surface. You can also look at the distal end, and if you see the knuckles, right, looking at you, with this big space in between, right, that's the posterior surface, as opposed to the smoother side here, that's the anterior surface. Okay, structures. The ball, right, that's the head. Right? There's a little hole at the end of the ball, right? That is the fovea. This area, right? That is the neck of the femur. And then here, the most lateral surface, right? That is the greater trochanter up here at the top proximal end of the femur. That's the greater trochanter. And as I said, this guy down here, that is the lesser trochanter. Now, if we look at the posterior surface, there's this kind of ridgy looking area right here just under the lesser trochanter, right? That is the gluteal tuberosity. The gluteal tuberosity, okay? As opposed to when we march more distal on the femur, this right here, that is the linea aspera, okay? So we're looking at now the more distal aspect of the femur in the shaft. That this line is the linea aspera versus this up here, which is the gluteal tuberosity. All right, moving down, these two guys here, these are the condyles, right? Femoral condyles, right? As opposed to the epicondyles. So the epicondyles, right? One is right here, okay? And the other one is here, okay? So these are the epicondyles. Condyles, epicondyles. Now, in case it wasn't obvious, right? This is pointing towards the medial side. So this is the medial epicondyle. The medial epicondyle is the lateral epicondyle. Now there's one more sort of landmark that's kind of hard to see on this femur, so I'm going to grab the left femur over here that I have. It's a little more obvious to differentiate the medial epicondyle, which is now on this side, right, to something called the adductor tubercle. I'll see if I can identify it for you. So this right here, this bump, that's the medial epicondyle right there, while this bump right here at the edge, I don't know if you can, yep, there you go, it's more obvious. That is the adductor tubercle, right? Medial side, medial epicondyle, adductor tubercle, right? The adductor tubercle is more proximal on the femur, right? So that's it. That's the femur. All right, moving on, let's talk next about the tibia. Okay, so the tibia, not as characteristic looking. One kind of giveaway is that the tibia kind of looks like it's a T, right? It's a little more symmetric up top where it looks like a T, so T for tibia, if that helps you. So, structures that are important for the tibia. So first we have the tibial condyles, right? Different from the femoral condyles, but that's where they sit, right? So these are the tibial condyles, and then you can see in between the tibial condyles, there's this little mountain. This is the intercondylar, right? This right here is the intercondylar eminence. Okay, it's between the two condyles, so intercondylar eminence. Right up front, this big bulging thing in the front, that is the tibial tuberosity. Now, there's a weird structure that is on the anterior surface of the lateral condyle. The lateral condyle is on this side, and it's very, very hard to see. If I kind of point it out like that, you can see the little ridge right there. Right, that is Gerdy's tubercle, right? It's right here. Gerdy's tubercle. It's on the lateral surface. How do I know this is the lateral surface? Well, if I look down at the bottom and I remember my anatomy, I know that this little guy over here, that is the medial malleolus. The tibia makes up the medial malleolus distally. So this is medial, this is lateral, right? And this guy right here, and again, it's going to be very vague, but that is Gerdy's tubercle, right? Gerdy's tubercle is basically where the IT band ends, right? Right here on the tibia. If he tags it, it'll be a little, clay here, and you'll be like, what the hell is he tagging? It's Gerdy's tubercle right here on the proximal end on the lateral proximal end of the tibia. All right, flipping us over here to the posterior side, we have something that, you can actually see it pretty good in the video. You see this kind of diagonal curve here, right? That line, it's going from lateral to medial, right? Downwards. That is called the soleal line, right? The soleal line, okay? And that's kind of the best view I can give you of it. And that's pretty much it, folks. So that's the tibia. Okay, and now it's time for another stick bone, bone that is very vague looking, and then thankfully there are really not that many structures on this vague looking bone, but this is the fibula. So you got to differentiate the two ends. That's pretty much all you have to be able to differentiate. So the proximal end, right, that's the fibular head, it is rounder in shape, kind of more bulbous, as opposed to the distal end, which kind of is more elongated and pointy and kind of has some asymmetry to it, which is important because it's making up part of our ankle mortise joint. So round, more pointed, more elongated, right? So the fibular head, the proximal end, this is the head, this is the neck, right? And then something called the apex. It's the highest point of the fibular head. Maybe it's that. I honestly couldn't even tell you on this. Perhaps it's even, this thing. If he puts something on the fibular head and it's at the very top point, it's the apex. There you go. And then, of course, down at the bottom, at the distal end, this is the lateral malleolus, right? So that's the distal end of the fibula makes up the lateral malleolus. So that's the fibula. All right, last but not least is the foot. Now this is a left foot. I know it doesn't fit my right leg model here, but this is what came in the box, so don't yell at me. So first, I know it's a left foot, partly because if I look at this toe, which I assume was the first toe, I know it's the first toe because it only has 2 phalanges, right? As opposed to the rest, which have 3. So this is the first toe, so this must be a left foot. So let's start with the major bones. So first we have this guy. So this guy, right, has that kind of trochlear surface here, that spindle-like surface, right? This is the talus, right? So this part of the talus right here, that's called the trochlea, right? Because it has that trochlear surface that sort of makes up our ankle mortise joint. In terms of the major parts of that anatomy, so this right here, this part of the talus, that's called the head, right? This is the head of the talus. And this part, right, where the trochlea is, that's the body. This is the body. So that's the space in between right here, right, that would be the neck. So head, neck, body of the talus. And then we said trochlea. And then back here, this little nub, right, that is the posterior process of the talus, okay? Underneath the talus right here, right, so again, talus here, this is the calcaneus, our heel bone, right? So this is the calcaneus, big, prominent. And then if you look at the medial surface, right, of the calcaneus, we see this process, which interfaces with the talus here. That's called the sustentaculum tali. So medial surface of the callus, big bone sticking out, attaching to the talus up here. Sustentaculum tali. All right, moving on. So once again, medial surface, lateral surface. Connecting to our talus on this side, just distal, is the navicular bone, okay? Navicular bone. While on this side, connecting to our calcaneus, is the cuboid, okay? Calcaneus cuboid, talus navicular, right there, okay? Moving more distal, we have these three bones on the medial surface. These are the cuneiforms, the medial, intermediate, and lateral cuneiforms, okay? And then after that, the metatarsals are here. These are the metatarsals. Note specifically, the fifth metatarsal has this. That's the tuberosity, the fifth metatarsal tuberosity. Okay? And then distal, we have the phalanges. So proximal phalanges, middle phalanges, and then the distal. And folks, that's the foot. And that's all the structures for your practical exam. You'll notice that it does mention those structures from your last exam. You know, I didn't cover them here. They really don't show up, but feel free to review those structures if you find the need. So thank you guys, and I hope this was helpful.